At the outset, let me thank PENSA and the organizing committee for having invited me to represent my country in COVID nutrition, and a very warm welcome to all delegates who've been tuning in for this particular Congress. India is home to one-fifth of the world's population. India's economic progress has been remarkable. However, burden of malnutrition remains to be quite substantial. The comprehensive National Nutrition Survey was the first ever nationally representative nutrition survey spanning between 2016 and 2018 of children and adolescents in India, conducted by the Ministry of Health and Family Welfare, ably supported by the UNICEF. This survey covered rural and urban areas across 30 states in the country. The survey statistics were not good, with stunting in girls of age 10 and boys of age 11 increasing to figures to almost 30%, indicating a very, very high rate of stunting. The government of India has been trying to improve these figures by a whole lot of schemes: targeted public distribution system, the midday meal system, the integrated child development service scheme. However, in spite of all this, the Global Nutrition Report, which is the world's leading independent assessment of the state of global nutrition, has revealed that in the year 2019, we were still grappling with stunting and wasting, among other nutrition problems. On December 2020, the fifth National Family Health Survey of India released. But what is important is the percentage of children who are reported to receive the benefit of diet adequacy of 20% or above. It was noted only in 6 states, with the highest ever diet adequacy of 29% in only a state called as Meghalaya. In fact, there were only 3 states out of 28, only Bihar, Manipur, and Sikkim, that reported a decline in the rate of stunting by at least 3 percentage points. This we now know is associated with a loss in economic productivity, which would have long lasting implications. In comparison to many other countries participating in the PENSA, India was really not doing well. Even the best that India could achieve was much lower than the rest. India already has an unenviable rank of 94 among 107 countries in the Global Hunger Index for 2020. In recognition of all these challenges that we need to overcome, the government of India has been doing its bit. And one of that is the Poshan Abhiyan, or the National Nutrition Mission, which was India's flagship program to improve nutritional outcomes in children, adolescents, pregnant and lactating mothers. The program took off to a flying start in 2018 with great participation from a large number of states, as shown in green. However, in 2019, COVID struck India fiercely. Needless to say, to stem the spread, the Prime Minister of India ordered a nationwide lockdown on March 24, 2020, and everything, like many other nations, went into a standstill. And the most impacted in India was school-going children, and as schools were shut. Alas, this impacted India's and probably the world's largest meal program, the midday meal program. The midday meal scheme for school children is a legal entitlement in India following the enactment of National Food Security Act in 2013, and a large number of Indian children were covered under the scheme. 21 states and union territories reported a lower offtake of food grades, as shown on the figure, from primary children in 2020 compared to 2019. Large number of children were put at risk of malnutrition. With the closure of schools, 369 million children had missed out on school meals, and many of these children relied on these meals as a source of daily nutrition. This is a grim foreboding for the future of India's children. Needless to say, in 2021, the National Nutrition Mission has been affected very, very badly and has seen very sparse activity. And this has far-reaching implications in nutrition of India. As of now, there is a large amount of reduction in nutrition building initiative right from 2018 to 2021. Well, let's change gears to hospital-based clinical nutrition during COVID. India is a land of diversities. This diversity is also visible in the spheres of medicine. This has also been one of the strategic assets that India has. In this aspect, I must inform that this august audience that India has many medical disciplines like Ayurveda, allopathy, homeopathy, Unani medicine, naturopathy, to name a few. Hence, we had advisories, statements, and guidelines that poured out of each of these forms of disciplines. The allopathic medicine itself had more than 3 sets of guidelines, including one that came out from my own institute, to SL Raheja Fortis in Mumbai. Now let's look at a snapshot of COVID-19 clinical nutrition in India. Well, we did a survey of around 60 hospitals of 2-tier and 3-tier cities, both including government and private hospitals. Was the clinical nutrition assessment done by the team in most of the country? Well, it does look like yes, the clinical nutrition assessment was done by the team, and if it was done, a good proportion of them were actually done by telephonic interviews, and almost 57% of them was done by face-to-face interviews, and a small proportion of them were done by social media like WhatsApp or any other computer-based devices. Almost 30 to 40% were at risk for malnourishment when they got admitted into the hospital is what it looks like. Among those patients that were not assessed, when the questions was asked as to why they were not assessed, there were few reasons for this. A large majority were because it was restricted by the administration to go to the patient. There was a fear among the clinical nutrition team to go towards the patient. There was a marked reduction in resources in some populations, and of course a marked reduction in manpower that occurred because many of these healthcare workers were also infected. When the question was asked as to why, how much of them used energy expenditure, I calculated them by indirect calorimetry. A very handful, only 2 hospitals in the country actually looked at indirect calorimetry when they were actually feeding their patients, whereas a large majority of them were actually looking at height, weight, and predictive equations. And the question was asked as to how many of them were adequately fed, it was much lesser than 50% among those that were adequately fed. And when they considered prone position, and the question was asked as to did they use prone position, did they start feeding? Well, good proportion of patients, almost 78%, were fed enterally, whereas only 21% were actually fed parenterally. Wholesome parenteral diet was given to almost 21% of patients. Among those patients who were fed enterally, full feeding was given to around 55% of patients, and around 45% patients were given trophic feeds. Among those that were given trophic feeds, the problems were meeting goals, aspiration, intolerance, high gastric residual volumes, and definitely communication issues. And a good percentage even said they were not comfortable to feed patients in the prone ventilation. Well, only 30% of patients followed up for a further consult, and that indicates that how scared people were to come back to the hospital or consult at that particular moment. Well, we looked at India as a whole. We looked at hospital-based nutrition, and now let's take a little bit peek into the ICU-based nutrition that we had in our country. Well, I would like to give a snapshot of the ICU that I work in because the data is very sparse in this respect. So looking at this, we had a use of total parenteral nutrition of only around 6%, and many of those of our patients were fed by Kitchen Plus enteral nutritional feeding formulae. Only scientific feeding formulae was fed only in 28.2%, but most importantly, the calorie prescribed was much higher than that was actually fed, indicating very high incidence of iatrogenic undernutrition in our patients. If you look at the graph of protein malnutrition, well, in the red, you have those patients that was supplied proteins, and the blue was the proteins that were prescribed. And there again, there was a very high incidence of iatrogenic undernutrition in the 1,000-odd patients that we treated in our ICU, which is a large tertiary care ICU concentrating on nutrition. Well, one thing that we did in our ICU was we used personalized medicine. And when we did indirect calorimetry, what we did know was that there was a wide variation among those patients, right from 800 calories to the requirements of almost 2,500 calories. Importantly, by day 4, day 5 onwards, there was a statistic climb, significant climb in the amount of energy requirements in these particular patients, and definitely followed by a hypermetabolic phase after 4 or 5 days. Most importantly, each patient had a different energy expenditure, and hence personal medicine was required, and it probably helped our patients is what it looked like. Yes, conclude the nutrition status of our country was not good to begin with. The Indian nutrition community faced a lot of challenges during this time. Nutrition took a backseat during this pandemic. Yes, SARS-CoV-19 has eclipsed humanity. India is definitely reeling. The Indian nutrition community is fighting hard. Yes, this virus is testing us. Some are doing well, some not. I hope and pray that we all come out victorious. Nutrition will play an extremely important role in this survival, and I'm sure this will hold the key to the resurrection of many countries and economies. Thank you very much for the patient hearing.